We human beings are social beings. We come into the world as the result of others' actions. We survive here in dependence on others. Whether we like it or not, there is hardly a moment of our lives when we do not benefit from others' activities. For this reason, it is hardly surprising that most of our happiness arises in the context of our relationships with others. The 14th Dalai Lama.
Humans are social creatures. We have lived communally since prehistoric times. That means that built into our physical beings, into our DNA, there's a sense that social isolation is a dangerous situation to our survival. Social isolation can increase our vigilance against threats, trigger fight or flight hormones that lead to fragmented sleep and increase in unnecessary cardiovascular activity. This is all because our pack doesn't have our back. Research affirms that these responses are built in to our physiology. Unsurprisingly, many studies have demonstrated a link between loneliness and poorer mental and physical health. In a 2018 study titled Loneliness, Social Isolation, and Cardiovascular Health, researchers found an association between social isolation and health risk behaviors like reduced physical activity, reduced sleep quality, and smoking. They also noticed loneliness has been associated with depression, anxiety, dysphoria, and social withdrawal. In 2015, Stephen Cole and other researchers at UCLA discovered that social isolation triggers cellular changes that result in chronic inflammation, predisposing the lonely to serious physical conditions like heart disease, stroke, metastatic cancer, and Alzheimer's disease. Another review of 16 studies on loneliness and social isolation discovered that loneliness and social isolation were correlated with increased risks of coronary heart disease and stroke. This means loneliness's impact on health is similar to anxiety and job stress, which are recognized as risk factors for coronary heart disease.
So, we went out to find if this correlation between loneliness and health is true in our region. In our recent study, participants were asked to respond to a set of 4 questions on a Likert scale, ranking their physical and mental health and their loneliness frequency and intensity. Try it yourself. On a scale of 1 to 10, 1 being frighteningly poor, to 10 being absolutely excellent, how would you rank your current physical health? What about your current mental health? Now, on a scale of 1 to 10, 1 being never and 10 being never ending, how often have you felt lonely in the past 3 months? What was the intensity of this loneliness? Choose the appropriate number between 1 and 10, with 1 being non-existent and 10 being unmanageable. We collected 248 responses for these questions directly from the Monadnock region. A graph of the results shows a strikingly clear inverse relationship between perceived health and perceived loneliness in the region. That is, the participants who perceive themselves to be in high mental and physical health tend to be lonely less often and less intensely. Is this true for you as well? About 23% of respondents reported being lonely fairly often. Those who report being frequently lonely have the lowest self-reported mental health.
More research is needed to understand the causations for this loneliness and health correlation. But we believe that addressing loneliness can improve public health outcomes. And there is room in our region to improve. According to the Community Health Improvement Plan by the Healthy Monadnock Alliance, in 2020, adults reporting good or better health in the region was 83%. The goal was 95%. In 2019, youth experiencing sadness or hopelessness in the region was 34%, and adults experiencing frequent mental health distress was 12%. The goal was 15% and 8% respectively. Because there is a connection between health and loneliness, reducing loneliness may lead to direct mental and physical health outcomes for our region. The arts are a candidate to do this. Please watch the next videos to see how.